Alzheimer's is a progressive brain disorder that primarily affects memory and thinking skills, eventually leading to a loss of cognitive function and the ability to perform daily tasks. It is significant because it affects many people and many families.
In most cases, Alzheimer's does not have a single genetic cause. Instead, it can usually be influenced by a combination of genes, including lifestyle and environmental factors. However, several genes have been identified that increase the risk of developing Alzheimer's disease, such as APOE gene, APP gene, PSEN1 gene, PSEN2 gene, and SORL1 gene. In Alzheimer's disease, faulty or missing proteins accumulate abnormally, forming plaques and tangles and disrupt brain function and lead to damage and cognitive decline. At a genetic level, Alzheimer's disease is linked to mutations in genes like APP, PSEN1, and PSEN2, which lead to the abnormal buildup of amyloid plaques and tau tangles in the brain, ultimately causing cell death and cognitive decline.
There is no cure for Alzheimer's, though there are treatments that can slow down the disease spread. Some treatment options are medications like cholinesterase inhibitors and mematime. There are also newer therapies you can use. These treatments carry the risk of brain swelling and bleeding. Some of these medications are also as low as $13 per month, while others cost $26,500 per year. Here are some symptoms for Alzheimer's. There are early stages, middle stages, and later stages. For early stages, most earlier stages are memory lapses. You may forget about earlier conversation or events, misplace items, forget names, places, and objects, have trouble thinking of the right word, asking questions repeatedly, finding it hard to make decisions, and becoming less flexible and more hesitant to try new things. For middle stages, there is increased confusion or disorientation, obsessive, repetitive, or impulsive behavior, delusions or feeling paranoid and suspicious about family members or caregivers. There's aphasia, disturbed sleep, mood swing, depression, feeling increasingly anxious and frustrated or agitated. Last, there's hallucinations. For later symptoms, there is dysphagia, difficulty changing position or moving without assistance, weight loss, unintentional passing of urine, gradual loss of speech, significant problems with short and long-term memory loss.
Alzheimer's is common for 5% of people aged 65 through 74 and 13.1% of people aged 75 through 84. Almost 2/3 of Americans with Alzheimer's are women. Older Black Americans are about twice as likely to have Alzheimer's or other dementias as older white Americans. The social challenges faced with Alzheimer's are less social and family stress. It also causes frustration and stress. The disease comes from genetics and has a dominant pattern, so kids have 50% chance of getting it.
Alzheimer's disease was discovered by German psychiatrist and neuropathologist Dr. Alois Alzheimer in 1864 to 1915. Major breakthroughs in understanding Alzheimer's include identifying genetic risk factors, developing biomarkers for early detection, and the development of disease-modifying medications.